Most people think shoulder pain comes from sleeping wrong, arthritis, or lifting something too heavy. But what if that pain is your body's warning sign of something much more serious? In today's video, we're going to explore the surprising connection between shoulder pain and breast cancer, the symptoms you should never ignore, and when it's time to see a doctor. This information could save a life. Shoulder pain is one of the most common complaints people experience. Most of the time, it's caused by muscle strain, arthritis, tendon injuries, or a pinched nerve. However, in rare cases, persistent shoulder pain can be associated with breast cancer. While shoulder pain by itself does not mean someone has breast cancer, it can sometimes be an important warning sign, especially when it occurs along with other symptoms. How can breast cancer cause shoulder pain? One way is through the spread of cancer. If breast cancer spreads to nearby lymph nodes, bones, or tissues around the shoulder, it can create pain that doesn't improve with rest or over-the-counter medications. Breast cancer may also irritate nerves that travel into the shoulder and arm, causing aching, burning, numbness, or tingling sensations. Another condition is inflammatory breast cancer. This aggressive but uncommon type of breast cancer often doesn't begin with a noticeable lump. Instead, it can cause swelling, redness, warmth, heaviness in the breast, and pain that may extend into the shoulder or upper arm. So what symptoms should women watch for? A lump in the breast or under the arm, persistent shoulder pain that lasts for several weeks without an obvious injury, swelling in the armpit or around the collarbone, changes in breast size or shape, skin that becomes red, thickened, or develops a dimpled appearance often described as looking like an orange peel, a nipple that suddenly turns inward, unexpected nipple discharge, especially if it contains blood, pain in the breast or chest that doesn't go away, unexplained weight loss, constant fatigue. If breast cancer spreads to the bones, women may experience deep aching pain in the shoulder, ribs, spine, hips, or other bones. This pain is often worse at night or while resting rather than during movement. Remember, there are many other causes of shoulder pain that are far more common than breast cancer. Rotator cuff injuries, frozen shoulder, arthritis, bursitis, tendinitis, pinched nerves in the neck, muscle strains. Heart disease can even cause pain that travels into the left shoulder, especially if it's accompanied by chest pressure, shortness of breath, sweating, nausea, or dizziness. Those symptoms require immediate emergency medical attention. When should someone see a healthcare provider? If shoulder pain lasts more than 2 or 3 weeks, if there's no history of injury, if the pain continues to get worse, if it's accompanied by a breast lump, swelling, nipple changes, skin changes, or enlarged lymph nodes, if pain wakes you from sleep every night, if you're experiencing unexplained weight loss or persistent fatigue. The good news is that breast cancer is much more treatable when it's detected early. Regular mammograms, monthly breast self-awareness, routine clinical breast exams when recommended, and paying attention to changes in your body can make a tremendous difference. One important reminder: shoulder pain alone usually is not breast cancer. Most shoulder pain has a non-cancerous cause. However, if you have persistent shoulder pain together with breast changes or other concerning symptoms, don't ignore it. Talk with your healthcare provider promptly. Early evaluation provides answers, and if something serious is present, early diagnosis offers the best chance for successful treatment. Your body often whispers before it screams. Listen to those whispers. Paying attention today could protect your health tomorrow. If this video has helped you or taught you something you didn't know, please take a moment to like this video, subscribe to the channel, and leave a comment below. You never know who may be struggling with unexplained shoulder pain or early signs of breast cancer. By sharing this video, you could help someone recognize symptoms sooner and encourage them to seek medical attention. Knowledge saves lives, and together we can spread information that truly makes a difference. To give you the best information concerning the topic, information has been collected from the American Cancer Society, the Centers for Disease Control and Prevention, CDC, the National Cancer Institute, the Mayo Clinic. These organizations provide evidence-based information on breast cancer symptoms, diagnosis, screening, and treatment. This video is intended for educational purposes only and should not replace medical advice from a qualified healthcare professional. Please follow up with your doctor. Thanks for your support and thanks for watching.